ഹലോ, സാവുമിൻ്റെ ഒരു പുതിയ എപ്പിസോഡിലേക്ക് നിങ്ങൾക്ക് എല്ലാവർക്കും സ്വാഗതം. നമ്മൾ ഇന്ന് വന്നിരിക്കുന്നത് നമ്മൾ ലാസ്റ്റ് ചെയ്തൊരു വീഡിയോയുടെ ഒരു കണ്ടിന്യൂഷൻ പോലെയാണ്. അത് മറ്റൊന്നിനെയും കുറിച്ചല്ല, നഴ്സിംഗ് കൗൺസിലിൽ പുതിയതായിട്ട് വന്നിരിക്കുന്ന ക്യാപ്പ് സ്റ്റോപ്പ് ചെയ്തുകൊണ്ട് പുതിയ പാത്വേ അതിനെപ്പറ്റിയുള്ള ഒരു വീഡിയോ നമ്മൾ ചെയ്തിട്ടുണ്ടായിരുന്നു. ഡിസംബർ 2023 തൊട്ട് ക്യാപ്പ് സ്റ്റോപ്പ് ചെയ്യുവാണ്. പുതിയ ഓൺലൈൻ തിയററ്റിക്കൽ എക്സാമും OSYയുമാണ് നഴ്സസിന് വേണ്ടിയിട്ട്, രജിസ്റ്റേർഡ് നഴ്സസിന് വേണ്ടിയിട്ട് ന്യൂസിലാൻഡ് നഴ്സിംഗ് കൗൺസിൽ ഒരുക്കിയിരിക്കുന്നത് എന്ന് പറഞ്ഞിട്ടുള്ള ഒരു വീഡിയോ. അപ്പോൾ ഇപ്പോൾ അതിൻ്റെ ഒരു ഡെഡ് ലൈൻ എന്നാണെന്ന് കറക്റ്റായിട്ടുള്ള ഡേറ്റ് മെൻഷൻ ചെയ്തുകൊണ്ടുള്ള ഒരു അനൗൺസ്മെൻറ്റ് നഴ്സിംഗ് കൗൺസിലിൻ്റെ വെബ്സൈറ്റിൽ വന്നിരിക്കുകയാണ്. അതിനെപ്പറ്റിയുള്ളൊരു വീഡിയോ ആണ് നമ്മളിന്ന് ചെയ്യുന്നത്. ആ ഡെഡ് ലൈൻ എന്നാണെന്നും അതിനെപ്പറ്റിയുള്ള ഒരു ബ്രീഫായിട്ടുള്ള ഐഡിയയും നിങ്ങൾക്ക് തരാൻ പോകുന്നത് മറ്റാരുമല്ല, കിം മാക്ലലൻ ഓപ്പറേഷൻസ് മാനേജർ ലോൺസ്റ്റൈലും നമ്മുടെ രാജേഷ് സാറും കൂടെ ചേർന്ന് ഒരു കമ്പൈൻഡ് ആയിട്ടുള്ള ഒരു സൂം ഇൻ്റർവ്യൂ അതാണ് നമ്മൾ അറേഞ്ച് ചെയ്തിരിക്കുന്നത്. അപ്പോൾ നിങ്ങൾ വീഡിയോ സ്കിപ്പ് ചെയ്യാതെ കാണുക, കാര്യങ്ങൾ മനസ്സിലാക്കുക, എന്നിട്ട് തിരിച്ചു വരിക. Hello, good evening everyone. We are back with another quick session. I promise it will be a quick session. We don't want to take so much of your valuable time. So it's regarding the new changes that was announced in Nursing Council regarding the cap, the stopping of the cap and implementation of new online theory and OSY test. So just want some clarifications regarding this from our cap provider. Yeah, operations manager Kim McLellan from Lonsdale and our Rajesh sir. This is basically about there was an announcement regarding stopping of cap from 2023 December, but there is another new announcement with the particular date mentioned in the website that it will be from 4th of December 2023, and we just want to know a brief idea about what will be the new changes and how it is going to affect the current candidates, those who have applied already to the CGFNS and Nursing Council. Could you please give us some explanation about this, Kim?
Sure. Kia ora, everyone. Obviously, I'm Kim McLellan, the Operations Manager at Lonsdale Education Centre. It's nice to touch base with you. New announcement. Obviously, we've got a date now. We've been waiting for a date specifically for the changes to be effective, and it's as of the 4th of December 2023. Anyone that is still in the CGFNS process and hasn't moved into the Nursing Council part before you get your decision letter will be given the new test of competence, so you won't be able to do a CAP course as it stands now. If you are in the Nursing Council process before the 4th of December, then you'll likely get a CAP letter that says that you will do a CAP as it stands now. So that means Lonsdale Education Centre, you'll do your competence assessment program with us, no problem. We will continue to run alongside the new program with Nursing Council for as long as we can. So what the new program will be is an online theoretical exam, and that will be in an accredited exam centre overseas. Now, that hasn't been announced who that specifically will be, but my understanding is possibly a testing centre called Pearson VUE, but Nursing Council is still yet to confirm that. So once you sit an online exam, it's very similar to the NCLEX exam, but it's very New Zealand centric, and there'll be things in there around New Zealand legislation, code of conduct, Treaty of Waitangi, cultural safety, and nursing practice in there. And once you pass that, then you have an ability to book an OSY in a testing centre in New Zealand. Now, the testing centre in New Zealand is still yet to be announced and may be announced towards the end of the year, maybe November or early December. So Nursing Council is still in the process of finalising and signing contracts with the provider, that whoever that is. That is not Lonsdale Education Centre. We will continue to run our CAP for as long as we can. So you will be required to do a 2-day orientation and preparation course in the same place that you'll be doing your OSY test. So that's to sort of help you understand a little bit more about New Zealand, nursing, culture, things like that. Then on the 3rd day, you will run through your OSCE. This is a 10-station high-stakes OSCE and will include a variety of different clinical assessments. We're not sure what they will be or what they'll look like, but it'll be very similar to those in Australia and the OSCE testing that happens in the UK. So that's sort of how it will be in the future. If you work your way through that very fast and effectively, then obviously that's great because it's a quicker process, hopefully, than the cap as it is now. But yeah.
So Kim, do you know any idea about how much will be the processing fees for the new applications?
So obviously CGFNS is its current fees, and I think that will stay, and the process for Nursing Council application will stay. We are unsure how much it's going to cost, and it will probably be with less than $500, I would say New Zealand dollars, for the MCQ exam. So Nursing Council have indicated they're following the Australian process quite closely. So I would say their fee structure will be very similar to that of Australia. They haven't announced what it will be. Obviously, they're still working through those finer details with the agency or the testing centre that's going to be announced. Currently, the Australian OSCE exam is 4,000 Australian dollars per sitting. So I would say New Zealand will be very similar. It may be 3,500 to 4,000. We just don't know at the moment, but I would say it will be around that figure.
Yeah.
Now, if you fail it, I would say you'd have to pay that same fee again and rebook.
Okay.
But like I said, that's as much information as we have at the moment. And as things progress over the next few months, we might have more information and more details to share.
So if the candidate will fail the theoretical or the OSCE examination, is there any possibility to get the Resit?
Yeah.
Absolutely. So I think how it works is you can sit your MCQ exam as many times as you need to before you come to New Zealand, and then the OSCE, they haven't announced how many attempts that you will be allowed and how that will look. So at the moment, I believe Australia is 2 attempts, and then there's a stand down period, and then you can apply again to do it. I'm not sure what Nursing Council will do. It is likely that it will be a similar model to that. So sit your OSCE. If you fail for some reason, then obviously you get an opportunity to resit, of course.
Yeah.
And Kim, already New Zealand Nursing Council has introduced the Enroled Nurse Cap program recently, and we have already done the video about that one. And will the new change will they affect the Enroled Nurse Cap program?
At the moment, Nursing Council have indicated that Enrolled Nurse Cap is not going to change at the same time as RN. However, things change quickly and some things change slowly. They have indicated that Enrolled Nurse Cap may change more towards mid of next year, rather than it being at the same time as the RN. I think they need to work on the RN process and then they'll change to EN. So at the moment, we'll continue to run Enrolled Nurse Cap as they get cap letters, no problem.
So already those who are doing CGFNS and waiting for the deal, or some are waiting for 1 or 2 modules to get cleared, they might be worried so much that will it be, they can reach the time frame and get the cap course. And also that is this question. It's a general question regarding will it be, what do you think, which will be the easiest pathway, like doing a cap, because you've been doing OSCE in Lonsdale. So it is, even if there is more stations, like as you said, it will be 10 stations will be possibly there. But still, what do you think? CAP will be the easiest pathway, or will it be difficult?
It's kind of an interesting question, I think, because I mean, for me, I think CAP as it stands can have its definite challenges. You know, it's definitely longer, it's definitely more intense. You know, we run sort of a two-part process. So we either have our normal CAP out in placement or we have our cohorts in-house. And either way, it's quite intense, and there's a lot of assessments and things that nurses have to do, as well as we use OSCEs in our CAP program, and they're a very good tool to help with clinical assessment and to help guide nurses around the expectation around autonomous practice, critical thinking, you know, working through a systematic nursing process. And the expectation of a nurse in New Zealand is quite high. So I think, you know, either way, you've got to put in a lot of work and effort. It's just what is your focus. So if you're doing the OSCE, of course, you focus on, you know, what that looks like and working on your nursing assessments. But you should be working on your nursing assessments and that before you come to New Zealand anyway, either way.
Yeah.
You know, the expectation of a nurse here is huge, and we would expect you to be able to work through a good systematic nursing process no matter what. So it's a bit of a hard one. Obviously, an OSCE and that being the test, it causes a lot of anxiety and stress, I think more so than something that is over a longer period of time. So a CAP is probably a bit more drawn out and maybe a little bit more supportive because you've got tutors, you've got guidance, you've got preceptors. You know, it's a more stepped process, whereas an OSCE is your booking. You turn up to the testing centre and you run through your scenarios, and it will be a lot more high stakes. You know, it will be a lot more. So nurses, I reckon, you know, you need to keep your nerves under control and believe in yourself and practice.
Yeah, and they're getting 2 days preparation courses as well. So hopefully they can just handle it very easily. And it is newly implementing here in New Zealand, so it won't be that much, you know, hassle to, you know, tackle it. Hopefully, yes. And Rajesh sir, do you want to ask anything?
I've got a few things to add here because, you know, you said that like that's a new one which is being just drawn and it won't be a hassle, but, you know, Ronia, things don't work like that. You know, nursing council have a certain set standard and they will want you to achieve it. Now, as a nurse, you know, like I'm putting myself in a nurse's shoe and thinking, like I've been practicing nursing in in India, or, you know, I've been working in the Gulf. It's quite different from the nursing which happens in New Zealand.
Yes, absolutely.
Because I've seen both. I've seen India, I've seen Gulf, I've seen New Zealand. So there's a huge difference between the way nurses practice and the nursing, you know, whole setup is. Now, my question, Kim, is like, you know, how is it going to be like for a person, you know, like this is what I've been dreading. You know, a person just comes in, gets a 2 days crash course, and the person is expected to sit there and do the OSCE testing and perform to the level as what a New Zealand nurse does. Is that what they're going to test? Isn't it? Like they don't have a substandard for the nurses who are coming from IQN. You know,
no, it'll be the standard. Obviously, they're checking a level at competent level, so they're not checking at proficient or expert, which in New Zealand we have 3 sort of levels: competent, proficient, and expert. So they'll be expecting you to be at competent level, not you know, this is sort of like at the end of a new graduate nurses program level. So, you know, I think it's sort of important to understand that you need to come prepared. You will need to put in a lot of work. You cannot be lazy thinking. You're going to have to be really intensely working on your English, your critical thinking. And, you know, obviously the nursing culture, say in India, is yes, doctor, no doctor. But in New Zealand, the nurses are the one going, right, doctor, I think my patient has a infection a chest infection, and should we be putting up some IV antibiotics, and should we be giving some pain relief? So it's the nurses are the ones leading it, they're driving it, and they liaise and they work at the same level as a doctor. Obviously, there's difference in their degrees and their specialties, but we work really closely together. There's no hierarchical. And so the nurses are expected to be able to make some good clinical critical decisions and be able to act. You must be able to manage an emergency situation, a choking, a cardiac arrest, basic first aid. You should be able to manage that competently when you're doing OSY testing and when you're caring for patients in New Zealand environment.
That's exactly, Ronia, what I was trying to put it forward. And it's not going to be like, because they don't have a different, entry level for an IQN, internationally qualified nurse. What is expected out of an IQN is that they should meet the same standard as a nursing graduate from New Zealand. Now, for 3 years of nursing, if like a person goes and does, if I'm studying in New Zealand, I do 3 years of my studies. I get exposed, I get placed in the different wards. Now I learn what is expected. And plus, I also understand how the culture works. And I understand what is expected out of a nurse. And those people, when they come and sit this exam, they will be able to deliver. They will be able to pass. Mm-hmm. But my question is what I personally feel is there is a lot of input these nurses will require, and who's going to give those inputs? And I'm sure that we'll not be able to provide all the nursing council or whichever the agency is going to run the OSY testing will not be able to provide all this input in the first 2 days. So there's going to be a big gap which we need to bridge.
Yeah. And I just think, be prepared, work on your communication. That's one big thing that's a real challenge for our IQNs, especially at the moment. It's the top thing. The nurse is not able to communicate effectively with the patients. And I had a situation recently where just simple things like introducing yourself to the patient and opening a dialogue. So just having a conversation, look, how are you doing today? How can I help? Is a good way to break down those barriers. So not introduce yourself and then suddenly go, I'm going to do your urine test. So, that's where it's like, whoa, are you, in New Zealand, our patients need to be fully informed, and they need to be, felt at ease with their nurse that they're caring for. It's not do the needful and do the necessary and you must. You've got to collaborate and work in partnership with your patients here. And that can be quite challenging because it's completely different in some circumstances to Indian or Philippine cultures.
As being a nurse in New Zealand for the last 2 years and been studied in India and worked in Middle East, and I can completely say that it is entirely different. Just wanted to give a clear cut information that we have a lot of input to do in the treatment of a patient, and we have loads and loads to do, and we are the advocate for the patient, and treatment plan can be changed as per your observation, our observation, and what we speak up for the patient. So it is basically not just working on the floor and just giving medications and what we are supposed to do. It's not like that. It is
sort of like nurse and patient-led care with doctor input. The doctors are obviously there to help adjust and change and work with in collaboration, but it's very much nurse and patient-led care here in New Zealand. And
the doctor will ask, what's your suggestion? Because they consider as nurses are with the patient 24 hours and they know better. So this is what we are lacking in India or any other Middle East, because we were not at all a part of the team. We were just to look after the patient in those 8 or 12 hours of our shift and just finish our duty and go. It's not like, that in here in New Zealand, we have a lot to do. We have a voice, and we are the part of the team. And once a treatment plan has changed, and doctors will ask you, what is your opinion? And do you agree that if we have any suggestions, we can say that and they will consider. And it is, really we are enjoying that part here. So it is really amazing once you start working here on the floor with the team. And there is no, as you said, there's no hierarchical level. Doctor is another profession, and nurse is another profession, and we are working together. And
all are working as a team.
And for the desired outcome for the patient. So it's quite amazing. And once you are here, you will feel that you are considered, and it's entirely different from there.
Yeah,
So
you just have to be able to prove,
Yes.
that you can escalate, critical think. You can
Yes.
work as part of a team and collaborate, because the collaboration between the MDT meetings and the patient is really important in New Zealand.
yeah, so that's what they are, testing that ability and everything in OSY. So I think this is all about our new change. And as I promised, I don't want to take a lot of your time. So can we wind up? Thank you so much. And it's all about all information that we have now, and will be updated again and again as time progresses and the announcement will be published. So thank you so much for your time, Rajesh sir and Kim. Thank you so much.
Thank you. Bye for now.
Bye.
Bye-bye.
Bye.
Bye.
അപ്പോൾ നിങ്ങളെല്ലാവരും വീഡിയോ ഫുള്ളായിട്ട് കണ്ടെന്ന് വിചാരിക്കുന്നു, എല്ലാം മനസ്സിലായെന്ന് വിചാരിക്കുന്നു. അപ്പം ഡെഡ് ലൈൻ എന്നാണ് 4th December 2023. അപ്പോൾ 3rd December 2023 വരെ നഴ്സിംഗ് കൗൺസിലിൽ പേയ്മെൻറ്റ് ചെയ്തിരിക്കുന്ന എല്ലാവരും, CGFNS കംപ്ലീറ്റ് ചെയ്ത് നഴ്സിംഗ് കൗൺസിലിൽ പേയ്മെൻറ്റ് ചെയ്തിരിക്കുന്ന എല്ലാവരും സേഫാണ്, വറിയേണ്ട കാര്യമില്ല. നമുക്ക് OSYയെക്കുറിച്ചോ അല്ലെങ്കിൽ ഓൺലൈൻ തിയറി എക്സാമിനെ കുറിച്ചോ ടെസ്റ്റിംഗ് സെൻറ്റേഴ്സിനെ കുറിച്ചോ കൂടുതൽ അപ്ഡേഷൻ കിട്ടുന്നതനുസരിച്ച് നമ്മളിതുപോലെ അപ്ഡേറ്റ് ചെയ്തുകൊണ്ടിരിക്കും. അപ്പോൾ മിസ്സാക്കാതെ ഓരോ ഇൻഫർമേഷനും നിങ്ങൾ ഫോളോ ചെയ്യുക. ഇപ്പോൾ ആശ്വാസകരമായിട്ടുള്ള ഒരു വാർത്ത വന്നിരിക്കുന്നത് നമ്മുടെ എൻറോൾ നഴ്സസിന് വേണ്ടിയിട്ടുള്ളതാണ്. അവർക്ക് ഇപ്പോൾ ക്യാപ്പിൽ ഒരു ചേഞ്ചും ഇല്ല. അവർ ഇനി ഒരു അനൗൺസ്മെൻറ്റ് ഉണ്ടാകുന്നതുവരെ ക്യാപ്പ് തന്നെയായിരിക്കും അവർക്ക് കണ്ടിന്യൂ ചെയ്ത് പോകുന്നത്. അപ്പോൾ രജിസ്റ്റേർഡ് നഴ്സ് ആകാനുള്ളവർ എത്രയും പെട്ടെന്ന് പാത്വേ ഒക്കെ നമ്മൾ പ്രീവിയസ് വീഡിയോസൊക്കെ കാണാത്തവർ കാണുക, കണ്ടിട്ട് എത്രയും പെട്ടെന്ന് ക്യാപ്പ് എന്ന പാത്വേയിലേക്ക് പോകാൻ പറ്റുകയാണെങ്കിൽ അത് ചൂസ് ചെയ്യുക. അതല്ല എന്നുള്ളവർക്ക് നമ്മളുടെ പുതിയ പാത്വയെ പറ്റിയുള്ള കൂടുതൽ ഇൻഫർമേഷൻസ് അടുത്ത വീഡിയോകളിൽ വരുന്നതായിരിക്കും. അപ്പോൾ ഇനി അടുത്തൊരു ഇൻഫോർമേറ്റീവ് സെഷനുമായിട്ട് വരുന്നത് വരെ ബൈ.